Hi, my name is Kelly Stenwall, and I am applying for the nurse educator role at Western Iowa Tech. Today's date is October 17th, 2024. I would like to introduce you to Maslow's hierarchy of needs. Abraham Maslow created his hierarchy of needs in the mid 20th century. It is a psychological theory that relates to healthcare and our patients' needs. And it focuses on the values and the possibilities of human growth. Maslow belonged to the humanistic school of thought, and as a nursing student, it is important that you understand the different 5 levels of the needs and how to apply them to your nursing care. So, physiological, which is the lowest on the pyramid, is our basic human needs, and that relates to our air, water, food, shelter, sleep, reproduction, and clothing needs. And now, as long as all of our body is working well, our respiratory, our digestion, our cardiovascular are functioning, then those are good. But in order to evaluate these, what are we going to do? We're going to walk in our patient's room, and one of the things we can do is while we're walking in, we're looking at their skin. Are they sweaty? Are they conscious? If they're on a heart monitor, we're doing that. Otherwise, we're going to check their pulse, their respirations. Basically, we're checking their vitals to see. Let me make a quick note here that any interventions that need to take place, like say, are they nauseated? Is their heart rate irregular? Do they have chest pain? Are they having difficulties breathing? Those are emergent and we need to address those immediately. So if you can get those taken care of, we're able to move into the safety needs. So safety needs, once basic needs are met, you need to make your patient feel safe and secure. Our personal security, employment, resources, health, property, social abilities. So this comes in many, many forms. We have mental safety, we have physical safety. A person can have needs met with emotional security and financial stability. But one of the things as a nursing role is we need to make sure we have a safe home for these people. Good mental health, especially today, we need to make sure that patients have a good mental health. As a nurse, one way you can do this is to make your patient feel safe by following our safety precautions that are already in place. Side rails up. Do we get the call light in place? Making sure we're administering medications the way they're supposed to. People want to be able to experience order, predictability, and control over their situations. So we're also going to move up, once we've got their safety issues are taken care of, we're going to move up into our love and belonging or our social needs. Our social needs are there where we experience the human need for interpersonal relationships, connectedness, being part of a group. So we need to make sure that we see them and we hear them and we make sure that they feel that they are seen and heard when we're talking to our patients. So connectiveness to being part of a group. So when we have a child who is in an abusive family, they may supersede your physiological and safety needs in order to make sure that they are part of this group. Okay, so that is important when we're dealing with children who have abusive parents. Also, in the nursing world, I want to make sure that you understand that building a rapport with your patients is a big, huge step. How are you going to do that? Talk to your patients. Ask them, does your family live nearby? What kind of hobbies do you do? What do you do when you're not here? Encourage healthy social interactions and relationship with family members and family support whenever possible. So remember, we need to make sure that they feel seen and heard and safe. So we're doing this. We're going to go up to our esteem needs. And this is the 4th level, which includes self-worth. It is accomplishments, respect. Self-esteem refers to a person's overall sense of self. So we're looking at respect, self-esteem, status, recognition, strength, freedom, okay? So individuals in this area, they tend to gain respect, approval of others, and they want to feel a sense of accomplishment. As a nurse, you can help patients showing them how they've been active in their healthcare and make sure that they're active in their healthcare. Esteem is a typical human desire to be accepted and by others and to feel independent. They want to feel valued. Okay? So low self-esteem may result in many imbalances during this phase, and Maslow indicated that the need for respect and reputation is most important during adolescence and with children, and projecting their real self to establish esteem and dignity. Certain disease processes may also take away that person's ability to care for themselves, such as someone who's had a stroke or who has Parkinson's. In these cases, the person should be allowed and encouraged to as much for themselves as possible. If you are helping a patient recover from surgery, celebrate those small things that they do and their accomplishments. Say if you have someone who has an amputation and they have been able to now put on their prosthesis, celebrate that with that person. Okay? And then so let's look at the fifth and the top of his pyramid, which is the highest need, and that is self-actualization. Now, this describes someone's ability to realize their full potential, and people really want to reach this goal, and they have successfully completed the other levels at this stage. People are content, they're focused on their personal growth. So as a nurse, we help patients ensure that they are physically and emotionally prepared to leave the hospital. That's one of the things that we can do to help with their self-actualization. You can help prepare them by reminding how far they've come in their hospitalization, remind them that they're leaving in a better condition that they came in. And although Maslow did not believe that many of us totally reach the self-actualization or that inner potential, he did say that we have a transitory moment. So some of the transitory moments are things like when we have childbirth, graduation, peak experiences, sporting events, things like that. Maslow stated that he did not follow a strict linear format on this, and he said the order should be flexible, and for some the need for self-esteem may mean more than a creative fulfillment may mean more to the person than even these basic needs. Have you ever heard of a starving artist? So the starving artist thing comes because they may not be getting all the food and stuff they want, but they're doing everything else that they want to do with their life. He further proposed that patients possess two primary sets of needs, and those are growth and deficiency needs. So growth and deficiency needs is the deprivation, and so the deficiency needs say, I have to be motivated because I am deprived of sleep or food or whatever. So that's what's motivating me. And to be a better person is your growth. So friendship, I need to do that. I need to get more self-respect. I need to be a better person. And so those are the growth. Those are the two human needs sets that he proposed. And he also felt that lower deficiency needs had to be met in order to, with this set, the two human needs sets, the deficiency needs needed to be completed in order to do the growth. But later on during his career, he suggested you do not have to meet those baselines to achieve your higher goals. But by fulfilling the lower needs, that you are making the higher ones much easier to do. So I also wanted to note that Maslow later added additional needs within his hierarchy. So he did say aesthetic needs, which is for beauty and balance and form. And then he also added cognitive needs, which means for knowledge and meaning and self-worth. Now, I also want you to notice that later on, he also added, several more years later, he started to realize that he introduced his transcendence or spiritual needs. So significant life changes can change the order of all of these. So what do you think would be some of the things that changes how you would do this? One of the things would be the death of a spouse or a loved one, because then, especially if you were a stay-at-home mom, now all of a sudden you don't have this provided for you anymore. Okay, so I also want you to understand that sometimes these are different areas that need to be done for different areas of different people's lives, and they're not always going to focus on that because in different countries, one of these may mean more to someone than this does. So we also have to look at those differences, okay? Maslow's hierarchy of needs can be divided into 3 basic areas as well. So the lower ones are the physiological needs, which are safety and physiological. The second part of it, within level 3 and 4, are your psychological needs, which is your love and belonging and your esteem. And then the last one, of course, is your self-fulfillment needs. Excuse me for just 1 second. Oops, erase some of that. So what is included in all of these areas? I know this looks really busy, but I just want to finish this up strong here for you. And how do we relate this to nursing? Okay, so your physiological needs, again, which is your oxygen, nutrition, body temperature, shelter, clean drinking water, okay, is your patient breathing, vital signs, stable, water, what are they getting their medications, right? So we want to make sure that we're looking at this. Safety and security, safe home, financial security. We've gone through this. Physical safety is the core concept of nursing, and this should always be considered. Are your rails up? Did you give the right meds? Did you follow the right 5 rights? Okay. Ambulation, when you're ambulating a patient, do they require a gait belt? Love and social. Spending time with your patient helps facilitate family visits. We spend about 12 hours a day with our patients. Make them feel seen and heard. Check in with them. If you're busy and you've got 6 patients, go down the hallway and say, hey, George, are you doing okay? Is there anything I can do for you? Self-esteem, sense of self-worth. Assist that patient to be as independent as they possibly can be. Provide the education that they need in order to be discharged from the hospital and to be able to do the things that they can feel independent at home. Praise and accomplishments. So your self-actualization, experience them as better. Creativity, independence. Be the best they can do and help them seek the knowledge that they need to do in order to continue to make their lives better. Help and encourage, empower them. Empowering our patients is one of the best things that you can do. Remind them of their progress and their positive conversations with your patient. Ask them what is their goal, what is their long-term goals. Okay, that will help you to do that. Cognitive, explore that person's curiosity. Fulfilling this with knowledge makes them feel worthy. The aesthetic, focus on the need for beauty. They are focused on aesthetically pleasing person's environment. That's from the patient's view. So always remember, these are from the patient's view, not from ours. Transcendence is focused on the high-level spiritual needs and value that are beyond oneself. This can involve the need for religion, scientific knowledge, spirituality, or sense of connecting with the world as a whole. So my idea of what transcendence may not be the same as George. Okay? So lack of absence of physiological needs is found in even some of the poorest and underdeveloped countries. So what we should do is be wanting for all of our society and all of our patients to have the highest quality of life possible. So there were a couple problems that we may come up with, that problems with Maslow's theory. And you notice I flipped my physiological to the top on here because when we're taking care of patients, that is the first thing that we need to be addressing. Okay, so other problems with Maslow's theory might be cultural differences, cultural bias, which may be perceived as fully realized, or self-actualization in the United States may not be the same in China or Japan or wherever else this person comes from. So if you can think of more, let me know, and we will be happy to explore that with you. Thank you for taking me into consideration. Have a great day.